All right. So I'm just going to give a brief overview of the kind of four waves of the US overdose crisis and try and focus in on the end and the kind of unique role of novel synthetic drugs in driving the current crisis. So, first, I think it's important we set the stage by describing how the overdose crisis is a uniquely US kind of American problem. This is something that we are facing in this country to a far greater degree than in other places. Here on the y axis, you can see the per capita drug overdose death mortality for the top 10 countries most affected by this issue over time. And so there's 10 lines, one for each of the top 10 most affected countries. And you can see that the United States, unfortunately, at the kind of very top of this graph. And the data here run through 2019, even before everything got far worse during the COVID-19 pandemic. And so now we know that the US is something like 20 to 30 times the global average in drug overdose deaths, where at least 2 to 3 times more affected than the second most affected country. We're something like 5 times more affected than the average of kind of all of the other countries that are most affected by this. And so this is sort of an astronomical public health problem in this country. And I think it's important to understand how exceptional the crisis really is here for us. Now, this is a depiction of the four waves of the overdose crisis. This is simplified, but you can see wave one here. This is showing overdoses involving prescription opioids, and notably not fentanyls, right? But kind of other prescription opioids that really drove the first wave of the crisis. We can see it picking up in the early 2000s, kind of cresting in the mid 2010s and now declining. That was wave one. We can see wave two, which was driven by heroin. And here you can see in purple that heroin really started to uptick in 2010. That's when the second wave kind of began. It was much more rapid. It climbed up to a peak in about 2015, and again now is starting to go down when you look at heroin that does not involve fentanyl. Now, of course, fentanyl is, in the news, it's on everyone's mind, and this is illicit fentanyl is really driving the third wave of the overdose crisis. Most people would argue this started in about 2013. Here you can see the blue line of fentanyl deaths without stimulants starting to rise precipitously and kind of vastly overshadowing the previous waves, right? Kind of immediately overtaking the other drugs and kind of rocketing up to unprecedented levels. And a few years later, the fourth wave began, which is really polysubstance use. So fentanyl is the base, but it's really the combination of fentanyl with other substances. And here for simplicity, I've just shown with stimulants, so mostly methamphetamine and also cocaine. But really, you can think about this fourth wave category representing a kind of very diverse polysubstance risk environment with a lot of different things being used together. And you can see that this is data through the end of 2021. And I think we're on track, unfortunately, to have the combination of fentanyl and stimulants be by far the most common kind of combination of drugs involved in fatal overdoses, really, but once by the time we have data for 2022. So the fourth wave of the overdose crisis is often described as being characterized by the combination of fentanyl and stimulants, but I would argue it is so much more, and that's what we're going to talk about today. So that's the kind of first characteristic. It's driven by illicit fentanyls and stimulants, but critically, it's also being driven by a huge variety of potent, in many cases novel, synthetic analogs in various drug classes like benzodiazepines, cannabinoids, stimulants, non-fentanyl opioids, so on and so forth. And the intentional and unintentional polysubstance use of all of these things in kind of many cases prepackaged formulations and widespread counterfeiting. So you never know what you're buying in the illicit drug market these days. You might think you're buying a legal product and it's fentanyl and a bunch of other things. You might think you're buying an illicit product, but you can't actually be sure about which illicit product you're buying. Another characteristic is the extreme exacerbation during the COVID-19 pandemic. And finally, it's important to note that there have been really sharply rising racial and ethnic disparities in the overdose crisis, where now Black and Indigenous Americans are by far the most affected groups. So just to quickly provide some more data showing some of these trends, here you can see the total number of overdose deaths in the US by year from 2010 to 2021. Of course, the number has increased dramatically during this period. And you can see here in yellow the fraction of overdoses that did not involve fentanyl and did not involve stimulants. And that was the vast majority back in 2010 because these were other opioids and other drugs that were involved, in many cases, drugs obtained through the healthcare system. And by the time we go over to 2021, we have shifted to the vast majority representing either the base of fentanyl without stimulants here in blue or fentanyl with stimulants here in purple. There is an important role of stimulants without fentanyl, but you can see it's only about 1 out of every 5 deaths. And this remainder category is now only 16% of deaths that don't involve fentanyl or stimulants. And so this is the base, but it's important to understand what actually the kind of mix of fentanyl and stimulants really means. So here's an example of one illicit drug sample from Chicago and that was examined, and you can see all the different things that were in it: diphenhydramine, fentanyl, xylazine, cocaine, a number of other fentanyl analogs and benzodiazepine analogs. And you can just imagine how confusing it would be for a kind of consumer of a product like this to try and have any, the concentration of all of these elements is kind of varying on a potentially daily basis. And just how kind of messy and chaotic the illicit drug market is right now. This is what is driving this kind of unprecedented overdose death crisis in the US. Xylazine, I think, has also been on the news a lot. It's a veterinary tranquilizer that has been associated with soft tissue infections, overdose that is not fully responsive to Narcan. Here's a picture of kind of veterinary xylazine, which is what initially was being diverted and added to the opioid supply, but now we know that there is illicit xylazine being mixed into the fentanyl supply on a kind of massive scale. And here's a map from a paper that we put out last year that just shows the spread of xylazine across the country in toxicology data. And so xylazine, I think, is a very notable new compound that's spreading across the country that has new risks and is complicating medical care. But really, xylazine is showing us that fentanyl is fundamentally changing the nature of the illicit drug market. So now that we're not producing the kind of bulk of the illicit drugs that are consumed in the US in a field, they're in an agricultural setting, they're being produced in a laboratory. It's really lowered the barrier to producing a whole host of compounds. And this kind of rapid market, free market experimentation in polysubstance formulations and in a vast variety of drug classes. And xylazine is one of them. And there are many others, as we're going to talk about today. And we're seeing that xylazine with fentanyl is actually outcompeting fentanyl by itself. I think because of the kind of characteristics of fentanyl, which is that it's very short acting. So people, it's very logistically inconvenient to be physically dependent on fentanyl compared to other opioids. And this is kind of pushing people to seek out polysubstance formulations to try and improve the kind of consumer experience that they're having, to put it in simple terms. And this is, I think, my last slide. I'll just say that, counterfeit pills are really driving risk for new subpopulations that have not historically been exposed to fentanyls and other kind of the most dangerous drugs. Here is a graph on the left from a recent paper showing a number of real and counterfeit oxycodone pills, right? And you can see that there's basically no way to differentiate these pills. These were acquired in illicit markets in close proximity to one another, and there's absolutely no way to tell which ones contain a potentially lethal amount of fentanyl and other novel synthetic substances, and which ones actually contain oxycodone. And one example of a new subpopulation that has been at increased risk because of counterfeit pills is teenagers. And here's some data from an article that we put out last year just showing that high school age teenage overdose deaths are kind of spiking for the first time in recent history. And it's driven by illicit fentanyls and other synthetic drugs in counterfeit pills. So with that, I'll stop. Here's a QR code that links to all of the articles and data that I've presented today. if you want to scan it with your phone. And looking forward to the rest of the discussion. Thanks.
Perfect. I appreciate you sharing that. And again, I think the visuals and seeing the data, really drives home the heart of this issue. So thank you so much for putting that together.